As an eye care professional, you may come across dry eye syndrome frequently. It's a progressive disease that affects a lot of people. Patients need medication and regular visits to a specialist to regain their quality of life. By screening for and diagnosing dry eye syndrome, you are not only helping your patients, you are also generating more and regular billable visits and can sell more supplements like eye drops and other treatment options. However, a successful dry eye clinic requires more than looking for and diagnosing the syndrome. Dry eye treatment starts with patient education. Without it, patients will not be easily convinced that dry eye syndrome is something that they need to take seriously and that requires a treatment plan with regular visits to a specialist. This is where the OCULUS KM5 5M comes in. The OCULUS KM5 5M is both a diagnostic tool for dry eye syndrome and a patient education tool. As a diagnostic tool, it can perform meibography, non-invasive breakup time, tear meniscus height, and bulbar redness tests. The OCULUS KM5 5M can also be used as an anterior segment camera for documentation of still images and videos. With it, you can screen more patients for dry eye syndrome and diagnose them more easily. This will give you the chance to help more patients, but to help them, you need to convince them of the need for professional treatment. As an education tool, what makes the OCULUS KM5 5M unique is the GenVis Pro Dry Eye Report. It is an easily understandable one-page summary of the tests performed. It includes visual aids to help you explain and your patient understand what they are suffering from. You can also enter data you have collected from other tests, such as osmolarity, blink rate, OSDI dry eye questionnaire, and the slit lamp observations. Based on the report, you can educate your patient on their type of dry eye and advise a suitable treatment. They will be more easily convinced if they truly understand what they are suffering from. During follow-up visits, you can use it to monitor the post-treatment result and show your patient that your plan is working. Everything considered, the OCULUS KM5 5M helps everyone involved. It helps you screen and diagnose more patients. It helps your patients understand their problem and the need for treatment. And through all that, it helps you run a successful dry eye clinic with happy patients and more revenue.